All right, CRP and Central. I'm here at ACRP. We just had an amazing event, awesome panels, and one of the most inspirational panels was my friend here. Would you like to introduce yourself?
Sure, thank you so much, Dr. Fox. My name is Lynn Bartholow, and I'm the founder of Circle Clinical Research, based in Sioux Falls, South Dakota, where we focus on historically underrepresented communities and connecting them to clinical trials. And as an enrolled tribal member, I'm very passionate about inclusion of Indigenous communities.
And so, Lynn, one of the most powerful parts about your presentation was the discussion of your dress. Would you be willing to tell us about your dress?
Sure. So I'll try to be as brief as possible, but the reason why I wear this ribbon skirt is Indigenous women, they wear ribbon skirts to important ceremonies or events. And traditionally, those ceremonies are things called inipi, which is sweat, or wachipi, which is powwows. So I don't know if you've ever attended a powwow, but the reason why we do that, because it's an important, it's like at a wedding. You see a woman in a wedding dress. It's an important piece of clothing. And the reason why I wear this is because my heritage is Dakota and Nakota, and those people, the people, my ancestors, my grandmother was forced to go to an Indian boarding school at the age of 8, and during that time of that injustice, she wasn't allowed to speak her language, she wasn't allowed to practice her religion, and she definitely wasn't allowed to wear ribbon skirts like this. And so it's especially meaningful for me to wear this skirt to really honor my ancestors who were not able to do that.
Wow. And so coming from the Diversity family, Diversity Trials, where we really want to embrace diversity, learn about cultures, and accept one another, that's what was really inspirational to me. So can you tell me how in your culture, or what you think we could do to better have inclusivity for our Native American tribes or populations?
That's a really great question. I'm so glad that you asked it. When we talk about enrollment of Indigenous communities into clinical trials, we need to think about all the injustices that have been committed over time, over years, decades, and the reason why, it is so important is because of those injustices, they have experienced such health disparities, and I see health disparities, our clinical research as a way to address those health disparities. My grandfather, who was Native American, he died of kidney disease progression. He lived in a very rural area, and when he got to the point where he needed dialysis, there really wasn't an option for where he lived, and so he elected not to do dialysis and passed away from that. And as you may know, Native Americans, he had diabetes for many years, and Native Americans have a very, very disproportionately high rate of diabetes and kidney disease. And why I do this is because I want to have clinical trials available for other people's grandpas who may have kidney disease, and maybe we could do something to delay the progression of that kidney disease so their loved one could be around longer. My grandfather was an amazing, amazing patriarch. He was a decorated World War II veteran. And I could go on and on about my grandpa, but really the reason why I do that is because why I started my company is because I want to reach out, because of my heritage and because of my lived experience. I want to reach out and touch Indigenous communities so that they have the opportunity to potentially be a part of a clinical trial that could benefit them, not only them, but future generations.
So almost, and just like that skirt that you're wearing is honoring your ancestors, I think that it's really important, especially when you started Circle Clinical, when you enroll patients in our clinical trials, that we have a diverse population who's representing your culture, it's almost like you are honoring your ancestors.
Yes.
So.
Yes, exactly.
Yes, exactly.
So, exactly. So actually,
Oh my gosh.
there's some story behind that as well. So I don't know if you're familiar with Indigenous 7-generation philosophy.
No, I do not know.
So Indigenous people embrace the 7-generation. I'll just call it a philosophy or a belief system, in that as a descendant, 7 generations ago, somebody was praying for me and believing that in the resilience and belief of praying for the generations ahead of them. And so I actually know 7 generations ago, my great 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 grandmother, her name was Red Nest, and she was born in 1818. And
She prayed for you.
Yeah, and she prayed for me to be here.
Wow.
And so what I think about in clinical research, I'm thinking about the 7 generations that are going to be coming
Who will you be
after
praying
me,
for?
and the ones that I'm
Oh
going to
my
be praying
gosh,
for.
I just got goosebumps. Well, admittedly, let's get you on the podcast because I want to expand this conversation. But importantly, Lynn, welcome to our Diversive family. We welcome you into this, and I really, really want Circle Clinical to do wonderful things. Most importantly,
Absolutely.
Thanks so much for joining the Diversity Trials group, the CRP and Central group, and importantly, we'll see you next time.
Great, thank you.